Interested in learning more about GERD, gastroesophageal reflux disease. In GERD, stomach acid flows back into the esophagus, causing symptoms such as heartburn and chest pain. In the absence of treatment, GERD can lead to serious complications such as inflammation, ulcers, and scarring of the esophagus. Here you will find information on statistics, symptoms, signs, causes, treatments, and how GERD differs from other conditions like peptic ulcer disease and gastritis. Statisticians on GERD. GERD is the most common digestive disorder in the United States, affecting approximately 20% of the population, according to the National Institute of Diabetes and Digestive and Kidney Diseases. People of all ages can be affected by this condition, although it is more common in adults. Asthmatics are also at a greater risk of developing GERD. Furthermore, the Cleveland Clinic reports that more than 75% of asthmatics also suffer from GERD. A description of GERD symptoms and signs. Heartburn, chest pain, difficulty swallowing, and regurgitation of food or sour liquid are all common symptoms of GERD. Other symptoms may include a sour or bitter taste in the mouth, coughing or wheezing, or hoarseness. In addition, GERD may cause chest pain that mimics a heart attack and can be accompanied by shortness of breath, nausea, and sweating. The causes of GERD. A weak lower esophageal sphincter causes gastroesophageal reflux disease, GERD. A number of factors can contribute to the weakening of the lower esophageal sphincter, including obesity, pregnancy, smoking, and eating large meals. Additionally, chronic use of certain medications, such as ibuprofen and aspirin, can also weaken the lower esophageal sphincter and increase the risk of developing GERD. Reducing or eliminating these lifestyle and medication factors can help to strengthen the lower esophageal sphincter, which may help to reduce the risk of developing GERD. The treatment of GERD. GERD is typically treated with medications, lifestyle changes, and/or surgery. GERD can be treated with antacids, proton pump inhibitors, H2 receptor blockers, and promotional agents such as motilium. An antacid neutralizes stomach acid and can provide short-term relief, such as Ulcer, while proton pump inhibitors reduce the amount of acid produced by the stomach. Examples include Nexium and pantoprazole. You may be able to relieve your GERD symptoms by eating smaller meals, avoiding trigger foods, and avoiding lying down for 4 hours after eating. Contrasting GERD, gastritis, and peptic ulcer disease, the most severe disease of the three, peptic ulcer disease, is distinct from GERD and gastritis. Peptic ulcer disease is a condition that occurs when a break occurs in the inner lining of the stomach, the first part of the small intestine, or sometimes in the lower esophagus. A stomach infection caused by Helicobacter pylori commonly causes this condition. It is a spiral-shaped bacterium that can survive in the acidic environment of the stomach. Occasionally, Helicobacter infections may lead to stomach cancer. People who have Helicobacter pylori infections for a long period of time are more likely to develop stomach cancer. Helicobacter pylori infections should therefore be treated as soon as they are detected with antibiotics. Non-steroidal anti-inflammatory drugs are also known to cause peptic ulcer disease. A person who regularly takes aspirin or ibuprofen may be more likely to develop peptic ulcer disease because these medications irritate the stomach lining. The symptoms of peptic ulcer disease may include abdominal pain, nausea, vomiting, and weight loss. There are several possible complications associated with peptic ulcer disease, including bleeding, infection, and stomach perforation. Leaving this untreated can lead to sepsis, which can be fatal. Gastritis is inflammation of the stomach lining is usually caused by Helicobacter pylori or non-steroidal anti-inflammatory drugs. Gastritis can also be caused by other factors, such as head injury, burns, alcohol consumption, bile reflux, or radiation therapy. The GERD is characterized by heartburn, chest pain, and difficulty swallowing and is caused by a weakened lower esophageal sphincter. The complications of GERD include inflammation of the esophagus, ulcers, narrowing of the esophagus, and Barrett's esophagus, a condition that increases the risk of esophageal cancer. In conclusion, GERD is a common digestive disorder that affects millions. However, not all cases of GERD are serious. Many people experience heartburn and chest pain occasionally, without any lasting damage. And while Barrett's esophagus can increase the risk of esophageal cancer, the vast majority of people with this condition will never develop cancer. Therefore, it is important to be aware of the symptoms of GERD and to seek advice from a doctor if needed. Regular screenings and lifestyle changes can help to reduce the risk of serious complications. With the right treatment, GERD can be managed effectively.